Gently, gently. That's it right there. Hey, it's Dr. John here. I got a patient, young kid, came in complaining of a chronic ingrown toenail on both sides to his big toe. So we decided to do a procedure where we do a phenol matrixectomy, or AKA partial permanent nail avulsion. Here you can see I'm using a freer elevator to loosen up the nail plate on both sides here. This just allows me to easily cut that side of the nail that's digging in and causing this patient his problem. If we don't do this, sometimes we can actually lift up too much of the remainder of the nail in the middle that we don't want to damage. So this just makes it much easier. Here I'm using an English anvil nail splitter. What this allows me to do is just cut that nail plate exactly in a measured manner, and I'm trying to make sure I'm going all the way back as far as I can without damaging any other tissue, including the nail bed. Now that nail bed is basically thin tissue that sits right over the bone or the distal phalanx, and we want to make sure that we don't puncture that or cut that, because that is where infections could even get worse there. So I'm using a hemostat here, and we're going to just gently kind of pry this out. And on this side here, I'm trying to take it out, but you know what? Oh, it's a little stuck. There's a little piece of the nail that was not cut. So I've got to go back with the English anvil and make sure that, hey, there is no remainder of that nail attached to the back portion. Because if you leave a little bit and you rip it out and there's a little bit of nail that's left, that is how you get reoccurrence and pretty much a failure of that ingrown procedure. So that's removed. I want to make sure that there's no other remnants there. Same thing on this side. We're going to remove that nail, and that came out pretty easy. So pretty confident that we cut all the way back far enough. Next, I'll use a curette here. And this is mainly just to make sure and double check that there's no remainder of any nail plate. And also trying to take off any of this nail attachment of the soft tissue to the nail bed, because the nail plate can grow from this tissue. And we're just trying to make sure that we remove any of that area of the nail tissue that could cause a regrowth of nail. And again, you can see I have a tourniquet, that little blue tourniquet that is on the toe, just to keep this dry. Very, very important to keep it dry, because when we add the chemical to cauterize the nail matrix, which is phenol, and that's what I'm doing right here, it's a very tiny little bit on those cotton tip applicators. We want to make sure there's no blood that dilutes the phenol to, keep it from doing what it needs to do, which is to cauterize the nail matrix and to destroy that so it does not produce any nail. So again, making sure that we get a good enough application. And I'll typically do this about 3 times. We want to have at least 60 seconds worth of contact time of the phenol to that matrix tissue to adequately destroy it. They did a study that showed that sometimes when docs would hurry and do this procedure, they would apply for about 10 seconds, 20 seconds. It did not destroy all of the nail tissue. So 60 seconds seemed to have been the best way to really adequately get rid of that nail tissue. Now here, again, using the curette again, as you can see, there's a little bit of nail tissue that still was kind of lingering around. We want to make sure we remove that so that the tissue can heal properly and there's no remainder of a nail plate that would regrow. Again, keeping this area bloodless with the tourniquet is important when we're applying the phenol here. A lot of people ask, well, how is this going to grow back and how is it going to look? And I definitely need to probably put a video together with a 6-month post-op for a nail procedure. That would be actually helpful for a lot of people. But essentially, the nail and the skin will start to remodel and kind of meet up with each other. So you don't have these gaps like this that you see right now after everything's healed. After it's remodeled, and that takes several months to kind of look normal again. And the only time a lot of patients are the only ones, the patient themselves are the only ones who know that, hey, I had something done. But initially for 2 weeks, this will drain. This will get a little red, get a oozing a little bit. That is one thing that a lot of patients think it's an infection, but it's really the phenol chemical that's doing that, causing that drainage and redness there. And so we'll remove the tourniquet and again, flush this with alcohol, which is just did there. That just makes sure that there's no remainder of any phenol hanging around. And then basically we'll apply a Marigel, which is my favorite topical ointment to use after phenol matrixectomies. And if you're interested in purchasing that, I'll leave a link below. We'll apply some of this Marigel on there, and the patient will do this every day with his post-op nail kit. I'll put some gauze on there and an adhesive bandage, and I'll see him back in a week, and he's back in a shoe tomorrow. I hope you all enjoyed that. Hopefully that was informative. Again, thanks for tuning in. Subscribe, click that like button, and we'll see you next time.